Hello, I'm Dr. Flora Waples, the founder and medical director of RESTOR Medical Spa. And today we're going to go through the top 5 questions that I hear about skin rejuvenation. The most common question I get is, what is skin rejuvenation? It's a great question. As we age, we are going to start seeing the effects of time and wear and tear on our skin. We develop small, tiny lines, wrinkles, brown and red pigment, and eventually laxity, where our skin actually will start to hang off of our bone structure. Skin rejuvenation, quite simply, is just that. We can take your skin to the gym and rebuild it to be the same as it was when you were in your 30s. And we're not talking about cosmetic changes, things that wash off when you wash your face at night. We are talking about actual molecularly rebuilding the skin. The same way as when you go to the gym, you build muscle, that muscle is yours. When we use our skin rejuvenation techniques, the skin that you rebuild is yours. It's indistinguishable under a microscope from the skin of a 30-year-old. So skin rejuvenation is truly that. It is using our tools at our disposal to actually regenerate your skin. Second question, why do we need it? Because skin, like muscle, is a lazy organ. And what do I mean by that? Your muscle has the ability to regenerate. If you decide you want to run a marathon, what do? You get up, you run a mile, and then you run 2 miles, then you run 3 miles. And that repetitive small stresses over time convince your muscle that it's necessary for it to build and grow, regenerate itself. And over time, it will. It's not going to do that if you don't run, because muscle is lazy. Skin's exactly the same way. Your skin has the ability to regenerate on its own. And you know this because you cut your arm and new skin grows. Your skin can do it, but your skin is lazy. It's not going to regenerate itself unless it feels like it's necessary. And that's where the tools that we use come in. We use our lasers and our microneedling and our topicals to send that signal to the skin that your muscles get when you run. That signal that says it's time to grow, it's time to regenerate, this is necessary. Your skin hears that message and your skin will regenerate. That is why we need to use these tools. Your skin's too lazy to do it by itself. Question number 3, how does skin regeneration work? It's exactly the same as going to the gym. When you go to the gym and you lift weights, what are you actually doing to that muscle? You're putting it under stress, right? Small, repeated stresses over time convince the muscle that it needs to be stronger. Skin rejuvenation acts in exactly the same way. We use different tools, whether microneedling, lasers, peels. We create tiny microscopic wounds, tiny microscopic areas of stress in the skin. Those small repeated stresses over time convince the skin that it needs to grow back thicker, stronger, and healthier than it was. So it works like going to the gym, only it's for your skin. Question number 4, how do I know what to get? Great question. Generally speaking, skin aging has 3 separate pieces. There's the pigment piece, the accumulation of browns and reds that come up in the skin, mostly from UV damage. Second piece is loss of collagen on the surface, which leads to little tiny lines and like crepe papery, literally like large pores, the tiny wispy lines that kind of come up all over our face. And then the third piece of that aging process of the skin is laxity, when the skin actually starts to lose its cohesion and starts to hang. We see that primarily on the jawline underneath the eyes. We have 3 separate classes of lasers and other tools to deal with those 3 separate pieces of the skin aging process. Pigment lasers are going to remove browns and reds, things like LaserMD or an IPL. Surface collagen work is going to take care of those fine lines, the tone, quality, and texture of the skin. Again, LaserMD is wonderful at that. Erbium, microneedling, there's many tools we can use to repair the surface tone, quality, texture of the skin, and you can ask your provider about which one is the right one for you. That third piece of the skin aging process, that laxity piece, where the skin just starts to get loose and it loses its elasticity. For that, Sculptra and microneedling with radiofrequency or microneedle RF are the tools to use. It can get complicated, so come on in, talk to your provider about which tool is the right one to rebuild your aging skin. The 5th question, and last, when should I start? Now. Same question if someone asked me, well, when should I start getting exercise? The answer is now. If somebody works out once or twice a week their whole life, and then when they're 50 they decide to run a marathon, they'll have to put in some extra work, but they'll be able to do it. If somebody sits on the couch until they're 60 and then decides to run a marathon, it's going to be a lot harder. Maintaining is much easier than rebuilding. And when it comes to skin, so much of what we do is preventative. So when is the right time to start working on skin maintenance and skin repair and skin regeneration? The answer to that is now. And those are the top 5 questions that people ask me most commonly about skin rejuvenation.